it's time to talk about the silent habits, quiet habits that rewrite fertility, right? You know, when people talk about smoking, right, they often associate it with lung disease. They associate it with heart problems. They, they even think of cancer, right? But very few people think about infertility. Please tap on your screen. Tap on your screen is important. Very few people think about infertility. But yet, in reproductive medicine, smoking is one of the most consistently proven lifestyle factor that changes or damages sperm. That's serious. And not just, the damage is not just slight, right? Is across major parameters, like you're going to see tonight. The damage smoking does to sperm. What makes it dangerous is not just what it does, right? But how silently it does it. Smoking. So yeah, a man may still feel strong. Yeah? A man may still perform excellent sexually. He may still ejaculate normally. Oh, Uche Kende is here. Good evening, long time. Good to see you. Such a long time. Good evening, you're welcome. How Otiwa is here. Akua Otiwa is here. How is your gym journey? I hope you're making progress, right? Good evening, Uche Kende. I appreciate you. Thank you for coming. I appreciate you, seriously. Right? So we're talking about smoking. It is not just because of what it does to reproductive health, but how it does what it does, right? So I was saying that a man may still feel strong, a man may still perform excellently in the other room, right? A man may even ejaculate normally, but at the microscopic levels, his sperm may be going through progressive damage because of smoking. That is why smoking is a very dangerous aspect that affects reproductive health. Right. Thank you for the follow, Mawumi. I'll follow you back ASAP. So I was also talking about before the network threw me off. Right. I was also talking about what cigarette smoke, what it contains. Thank you very much, Pastor Uche. Thank you. What cigarette smoke contains. So for those who smoke, I don't know whether you know this, but I'm telling you now. Do you know that cigarette smoke contains over 7,000 chemicals? Many of those 7,000 chemicals are toxic. Many of them are toxic. So why do people still smoke? For whatever reason. But for today, we're going to talk about the impact on reproductive health for men, because we are on a 30-day male infertility. We are just few days down the line. We're going to finish all that. You right? Natasha, I see you. Thank you for the follow. I'll follow you back as soon as possible. Right? So among the 7,000, I'll just mention maybe 5 of them, the one of interest, right? Because it's important. When you are smoking that, you are trying to conceive and you are smoking that thing, right? I know it does something here, but remember, while you are enjoying what is happening here, something is going on down there, right? So among the most harmful of the chemicals to sperm, you have nicotine, right? You have carbon monoxide. Carbon monoxide is not only in cigar. You can get it generator fumes. You can get it in the gas fumes. You can get it in charcoal fumes. So you want to put that in your body, something that kills people, right? There is also cadmium. Is it cadmium, right? Does smoking actually do anything good in the, it makes you high, right? So they say it makes them high. So when you get high, you forget your sorrows, right? Right. So there is also cadmium, and cadmium is a heavy metal, right? There is reactive oxygen species. We talked about that when we we're talking about alcohol the other day, right? So ROS is also one of those things. Then this one they call PAHS, right? Don't worry about the names, just understand the concept. So these substances, when people smoke, they enter the bloodstream, they will eventually get to the testes where sperm is being produced. And what do? They get straight to work, the work of damaging sperm production, right? So if you're still here, thank you very much for the shares, Uche Kende. If you're still here, please talk to me in the comment section. Let's go to the next. Let's begin to look at the impact, the effect of this smoking on sperm production. The first target of smoking is this production of sperm, right? That's the first target. Inside the testes, you have delicate structures, like I've said before, delicate structures. And those structures, don't worry about the names, right? And inside those structures, these are where the sperm cells are produced, right? So what smoking does is it disrupts the environment in many ways. When all those chemicals get there, it begins to change the environment in many ways. How does it do that? It reduces oxygen supply to the cells that are being produced, right? Because of the carbon monoxide that is in it, right? So even the whole body suffers for carbon monoxide, not to talk of the delicate sperm cells, right? So first, it reduces oxygen delivery to the testes. Next, it will introduce toxins. All these things I mentioned. Those toxins damage the developing sperm. Remember, one sperm cell, from the day it is created to the day it is mature, it takes up to 74 days. So while they are still young, your cigar is damaging them. It's damaging them. I told you one time we did semen analysis for a 30-year-old man. All his sperm cells are dead. All. What happened? You're still young. What happened to you? So you see, when we emphasize these things, it's not because we're trying to control people's lives. But you need to understand, what part of your health do you really value? Right? So it introduced those chemicals that will destroy the sperm cells, the developing sperm cells. Then it will alter the function of supporting cells, because it's not just sperm cells that are being produced. There are cells that support it. The cells that support it. So what happens when all this damage is done? What happens? What you have, fewer sperm cells are produced. Fewer. Think about it. Think about it. For a healthy man like me, right? Right? For a healthy man like me, every second, 1,500 sperm cells are produced. Every second. I'm talking about healthy men. Leave all these ones with alcohol and all those issues. Calm down. Stay with us first. Right? Adora, thank you very much. Right? Every second, 1,500 sperm cells are produced. So I'm looking at the seconds now. The moment it clicks the other way, 1,500 sperm cells produced. The next second, 1,500. The next second, 1,500. Every second. Then by the end of the day, a 24 hours span, of course, do the maths. We should be talking about over 100 million sperm cells produced in a day. If this smoking and its effects don't do anything around there, it reduces that number of production. Remember, we talked about what heat does, what alcohol does. Now look at what smoking is doing. So you have fewer sperm that we produce. And you will know because studies have consistently shown that smokers have lower sperm counts, right? When you compare to non-smokers like me, right? And the difference can be as large as 30% difference or even more. When we're talking about hundreds of millions of sperm cells in 24 hours, then what will smokers produce? Maybe fewer. They cannot even hit 100 million, right? So you want to be smart with your life, right? You want to be smart with your life. So that is the first attack. The first attack is the production of sperm. Now the sperm has been produced. What is the next attack of smoking? The next attack is motility, the ability. But doctor, why do some doctors who know this still smoke? That is a very excellent question. Yes. Why do doctors who know this, they still go ahead and smoke? Good. Because of what is doing here. I've never been high before, so I don't know what high feels like. But I think the feeling of high, right? Higher than the highest. I think that's what they're looking for. Right? Hi, Mama Maya. Good to see you. Sumi Love. Is Sumi Love here? Okay. Confirm that you're here. So that's the first thing. It attacks. Sumi Love is here. You're welcome. Krista, what do you mean by monkite? Please talk and well. I don't understand. I don't understand. Is it monkey tail? I cannot take monkey tail. It's not possible. Remember, I've already declared myself the chairman of 2 Minutes Men, right? So we need a hustle go anywhere. If you don't collect the one where you get, go and rest. You want to damage your life because you want to impress something or somebody, and then life does not work like that, right? So the next target of smoking is motility, the ability for sperm to move. Remember, it's not enough to produce sperm. The tendency of sperm is to move and move forward. That's why when they do semen analysis, among the things they look out for is, besides the sperm count. Yes, so you got it. No time. So your semen analysis, apart from the sperm count, we look at the motility. And among the motility, you look at the progressive and non-progressive. What does progressive mean? The ones that are moving forward. Because it's not enough to move. The question is, which direction are you moving? Are you moving backward? Are you just moving all over the place, perambulating? It is the one that move forward that can produce, that can actually get bring about pregnancy, right? Thank you very much. Right? But smoking. So I was talking about the effect of cigarette smoking on the motility. Motility is the ability for sperm to move. So that's what we're talking about. And I was saying that even if sperm is produced, even if even if yeah, I know, right? Christy Labelle. So even if when sperm are produced, they must move effectively to reach the egg. That is the sole purpose of producing sperm, ability to move and move forward, right? And smoking affects this, have a direct effect on this potential to move. The toxins from cigarette smoking. Ashakuma is here. Good to see you. You're welcome. Right? I said the toxins from cigarette smoking damage what produces energy for the sperm to move. It's a direct hit, right? It destroys the structure that produces energy. And without sufficient energy, good evening, you're welcome. Without sufficient energy, you have sperm that moves sluggishly. You have sperm that will fail to move forward. They don't even move at all. Even the ability to reach the egg is reduced. So what use is sperm if it's not going to reach egg? See, these are the things that result to what you call the reduced motility. When you go to do your semen analysis, you hear that motility is poor. That's what is causing it, right? That's what's causing it. That's what's causing it, and it's critical determinant in fertility. So one of the things you look for in your semen analysis is motility, and you want to know what is really causing the motility to be impaired. So that is the second thing that cigarette smoking will do to to fertility, right? The third thing. Thank you very much, Ashe Kumar. Thank you. Hey, Irene, I see you. You're welcome. The third thing is morphology, the shape of the sperm. Cigarette smoking, what does it do to the shape of sperm? What does it do? It does something. It makes them look abnormal. Sperm cell that is supposed to look the way, oval head, middle piece, normal tail, they start looking like willy willy. Right? I'm all right, Irene. I'm all right. It's good to see you. Right? So the morphology is affected by cigarette smoking. You've tried all the means? All right. You want to try the one we are teaching you now? If you need a private consultation, the information is on the screen. Right? But stay on the live stream and learn. So the morphology, the appearance of sperm will be affected by cigarette smoking. It will. So let's look at the details. How does that happen? Right? It affects how sperm are formed. Now, during the development, normally the sperm cell will go through an organized transformation, all those, right, just to give it the final shape. But the toxins in cigar will expose or even disrupt the process of shaping. When a child is born, what do we do? According to our African mothers, they will carry hot water, they press the head, press the bum so that they shape them, right? Well, our African mothers are very wonderful people, you know. so, so if you understand all that, understand that when sperm is formed, there is the shaping of sperm that is done. But cigar smoking will go and destroy that process. That's why the result of all that, you begin to see abnormal head of sperm, begin to see sperm that are bent like this, right? Or even coiled, irregular middle. So many of those funny things you see on the microscope, right? Because of what the cigar smoking is doing to the sperm shaping, right? And when a sperm does not look the way it's supposed to look, it's going to be very difficult to even pass the cervical mucus. It's going to be difficult to attach itself to the egg. It's going to be difficult to even the process of fertilization will be impaired. It will. Very important things that this cigarette smoking does to sperm. The worst that it will do is DNA fragmentation. And this is where smoking becomes especially dangerous, right? Like Uche Kendi asked earlier, so what do people gain from smoking anyway? What do they gain from smoking? DNA fragmentation. Beyond the sperm counts that you see, beyond the movements of sperm that you see, beyond the shape, there is something even more critical, and that is the sperm DNA integrity. This one, you will not see it on microscope. This one cannot be easily tested with your regular. AG Bless is here. Good evening. Good to see you. Long time. You're welcome. Sperm DNA integrity is not something you test in your regular tests. And this is one of the chief that determines the quality of sperm. Poor quality sperm means no pregnancy. What are we looking for? Pregnancy, yeah? So we need quality sperm, right? The reason why we need quality sperm is because sperm carries half of the genetic material that is necessary for forming a baby. So what does smoking does? Smoking increase oxidative stress, right? Which will produce dangerous combinations that affect the DNA inside the sperm. And now you have a good-looking sperm, but the content is nothing. The content is just off. And when you have badly damaged DNA like that, it can lead to genetic instability. And of course, even if fertilization takes place, the embryo will be poor quality embryo, reason for the many miscarriages that you see most women have today, right? So you have failed implantation, early miscarriages, poor embryo development. These are all the things that can happen when cigar smoking has damaged the sperm. This is why couples will experience repeated pregnancy failure despite normal results, normal sperm analysis, semen analysis. All the tests checks out fine, but why are we still having miscarriages? I'm telling you now. So if you're here, you're not following me, I wonder what you're waiting for. If you're trying to conceive, I would advise you to follow me because you need all the information I'm telling you, right? So that is number one now of all the things that happens to sperm because of smoking. That is number one. That's 4, right? So smoking also does something again very important, right? It does something very important. It disrupts hormonal disruptions. With all these things, If you smoke, you want to now go back and re-evaluate yourself. Why do I need to smoke? Right? Because smoking will interfere with your hormonal system that regulates sperm production. It's not only go there to destroy the cells, even the hormones that regulate it destroys it. It will reduce testosterone levels. Yeah, and testosterone is necessary for sperm production. The cells that support the production of sperm cells, it will destroy it. It will impair it. It will alter the signal from your brain that should tell the testes that produce sperm. It will alter. Right? So when all this confusion happens, testosterone will drop and sperm production declines. Then you are still asking the question, why are you not pregnant? I'm telling you why you are not pregnant, right? So it's a double impact situation for those who smoke, right? Double impact. Fewer sperm and weaker sperm. Double trouble, right? Fela Anikula Kuti of blessed memory, he said, double wahala for dead body, right? The next thing is oxidative stress, right? That's big grammar. Let's look for a simpler way to put it. Okay, you want to think of sperm, right? Think of sperm as a delicate cell. Of course, it is a delicate cell, and it has a protective outer membrane, right? So this delicate cell has a protective outer membrane. What smoking does, smoking would, you see all those dangerous chemicals I mentioned earlier? It will release those chemicals in the direction of the sperm. It will destroy that protective area, destroy the cell membrane, right? Destroy it. And now this destruction that comes from those chemicals will be cell membrane damage, protein damage, and DNA damage. Because sperm are particularly vulnerable because they have limited antioxidant defense. So if you are here when I'm going to talk about sleep, the effect of sleep on sperm, right? You will understand something. You'll be able to connect this sentence to that, but you need to be there. If you miss it, you miss out, right? So the cumulative effect of this chemical damage to sperm will result to motility, decline, morphology disruption, and DNA quality that is poor because of DNA fragmentation, right? Very important. So what are you going to do? You're going to stop smoking, right? Please stop smoking. Stop smoking if you are trying to conceive. Stop smoking. Right? So if you are just joining, you're welcome. Make sure you are following me and you are tapping on your screen. Right? That's very important. Now, there's this category of people who may think that I'm not talking to them. Right? This category of people thinks I'm not talking to them. Right? I call them the passive smokers. Patenu, I see you. If you're just joining, you're welcome. Make sure you're following me so that you can catch me tomorrow. Hello, sir. Why? Why what? Why what? You want to ask your question completely, or you wait till the Q&A, right? So let's talk about passive smokers. Is that Alcisana? You're going to teach me how to pronounce this name. because I'm always biting my tongue. You're welcome. Sana, good to see you. So we are talking about passive smokers. They are not the one that are smoking, but they are the one collecting, right? Why you not getting pregnant? That's the question I'm answering for you every day on the live stream. So, mommy Cargo, follow me. Stay on the live stream every day. You'll get clarity to your question. Is that okay? So, I want to talk about passive smokers. You are not the one smoking, but you're around those that are smoking. Do you know that men, even men who don't smoke, they will have direct effects of smoke in their system? Miss Clarissa, good to see you. Thank you for the heart, man. Hope you had a great day. You're welcome. Right? Even men who don't smoke, right? They don't smoke directly, but yet they're affected. Because whether you smoke directly or you're around people that smoke, you are a secondhand smoker. And secondhand smokers have been shown to be exposed to smoke, which affects them in areas of reduced sperm quality. All right, Mommy Kagbo, it's okay. Right. Good evening, Maureen Dari. So you are not smoking directly, but you stand around people who smoke. You have reduced sperm quality, right? You have increased oxidative stress, damaging your sperm, and hormonal disruption. So what are you going to do? You better run away from those who are smoking, right? So that's to say that living or working in a smoking environment can still affect your fertility. That's what I'm trying to say. That's what I'm trying to say. So whether you are the one smoking it or not, so long as you are around there, your boss will tell the story, right? Right. Now, one of the most misunderstood aspects of sperm health is what I want to talk about. So if you are still here, please talk to me. Type in the comment section, I'm here. I want to know you are there. And if you are not following me, hit the plus button now. And I want to ask you, why have you not dropped a heart me? You don't like the information I'm giving you? You don't like the information? Leave the live stream, right? Appreciation is one of the ways to benefit from the information I'm giving you, right? But nonetheless, I enjoy what I do. Susu, thank you very much. All right. So I want to talk about one of the most misunderstood aspects of sperm health, which is timing. Timing. First, understand, we've already established that sperm takes 70 to 90 days to develop, right? Remember? We've done that 1 or 2 weeks ago. So the effect of smoking today may not show up, right? May not show up until 3 months later. And we talked about that when I was teaching us how to produce precious sperm, right? So if you missed that episode, go to YouTube, search Dr. Godwin EMB, right? And look for precious sperm. The video is there for you to learn how to produce precious sperm. You just want knack, and it isn't because you are knacking you should have babies. It does not. Right? Understand the concept. Understand the concept. Sperm takes 70 to 90 days to develop from when it is produced as a cell to when it is matured and ready for delivery. And that's 70 to 90 days. Every second, 1,500 sperm cells are produced. You see how much volume of cells are being pushed out into the system. You see why the reason why you should be knacking, right? Please knack. So if you are married, knack. If you're trying to conceive, knack. It's important to keep pushing out those cells. And of course, semen benefits women. So whichever way, there's no loss anyway. So where was I? How did I get there? So I was saying that the effects of smoking today may not show up today. It may show up in 3 months' time. Why? Because of the timeline on which sperm cells are produced. This also means something encouraging, right? This knowledge means something encouraging. It means that if you stop smoking today, you can improve sperm quality in the coming months. So the damage that is done to the poor sperm you have today is a 3 months problem. If you want a quality sperm, you have to prepare today. In 3 months' time, have a quality sperm. Reason why, when we begin all this discussion, I said, if you're trying to conceive, learn something. Nobody will tell you this, but I'm telling you now. Learn something. Prepare your body 3 to 6 months before you try to start conceiving. Right? I will not say it again because you need to pay for that information. So go to YouTube, watch the video again. You will hear what I said. Because people are just doing things without knowledge. That's why they suffer for a very long time. You see, multiple studies across populations actually have shown that smoking is associated to longer time of conception. Smoking lowers pregnancy rates. Smoking increases the risk of miscarriage for the many reasons we have given today. What about in IVF situations or maybe assisted reproductive technology? Male smoking has been linked to lower fertilization rates. You are giving us poor quality sperm and you're expecting good results. Stop smoking, Oga. Is that okay? Right? Stop smoking. It has also shown that poor embryo quality is what we will get because of the things that has been done to sperm quality. Anything that affects sperm quality will affect embryo quality. Is that okay? So all these I've said shows that smoking does not just affect just sperm, but it affects the entire reproductive outcome. Juliet is here. You're welcome. All right. Now, there are aspects of smoking and fertility. Good evening, Lady G is here. Good evening. How was your day? Hope you had a great day. Good to see you. Good to see you. You're welcome. Right? Let me just tell us this rarely discussed fact. It's rare to talk about it. But trust that our amebo here is too much. Hi, Mali. Mali, good to see you. Right? Mali, good to see you. So I want to mention Mali's from South Africa. You're welcome. Good to see you. Right? Martha is here. Hello, Martha. Right? So there are aspects of smoking and fertility that people overlook. First, First, what do they overlook? First, smoking can damage the store of sperm. We call it epididymis. So, cigarette smoking will destroy the store. So, cigarette smoking will damage the store of sperm cells. Cigarette smoking, especially nicotine, may alter seminal fluid composition, all those richness, right, that comes with the sperm in the semen. Nicotine destroys it, reducing the protective capability and nourishment that the sperm is supposed to have. That's what cigarette smoking does. So, long story short, smokers can never have quality sperm. Thirdly, smoking has also been linked with epigenetic changes, that is, modification on how the genes are expressed, unfortunately. Right? Mali, you just came, so you wouldn't know, you wouldn't get the details. So just go to YouTube, listen to all the information from the beginning. Then you can put that question in perspective, right? Put it in perspective, then you understand what I'm talking about. I just told us that quality of sperm is a function of current lifestyle, right? Current lifestyle. So whatever I do wrongly today, the sperm cells that we produce in 3 months' time will collect the effect. so there are so many things to consider. All right. Now the good news. Who wants to hear the good news? It's not all bad news, bad news, bad news, bad news. The good news. Who wants to hear the good news? Good news, good news, good news. The good news is that, somebody asked the question, can the damage that is caused by these habits or lifestyle, can it be reversed? Well, the good news is that male reproductive system has the ability to recover. Is that not a good news? That's to say, when smoking stops, oxidative stress level decreases, right? Hormonal balance improves. New sperm are produced under healthier conditions, right? So within 3 to 6 months, you can have measurable improvements in sperm quality that can occur. So when you say somebody that used to drink, do you know the adjustments that he did in his lifestyle before he knocked wetin no good and got his wife pregnant? Yes, the same thing with alcohol. Long story short, 9 out of 10 issues with male infertility are reversible. The only things that are not reversible is that they were born that way, or there is a serious damage to their chromosome. These are the only 2 conditions. But every other thing that affects male fertility are reversible. Just change your lifestyle, improve your sleeping habits, improve your diet, right? And enough exercise, and you're good to go. Just knock away, right? Right. Well, remember, the extent of recovery, right, will be dependent on the duration of smoking and the intensity, the number of cigars per day, right? And also, beside all that, the overall health of the man, because you need to be healthy to have quality sperm cells. Is that okay? So If you have a question, please send your request. Let us take your question. But while we are waiting for your requests, right, I want to advise for men who are planning or who are trying to conceive, quitting smoking is one of the most powerful decisions that you can make. Right? It's one of the powerful decisions you can make. And the steps you can consider will include you want to stop active smoking completely, avoid second-hand smoking. You know what second-hand smoking is, right? No be you dey smoke, but na you the thing dey affect, right? That's second-hand smoking. Avoid second-hand smoking. Improve antioxidant intake, like enjoy lots of fruits and vegetables. Gonna help you. Maintain a healthy weight. Hit the gym if you have to. Maintain a healthy weight. Stay physically active. And ensure you're having good sleep. Regular, consistent, quality sleep is going to help you. Right? It's going to help you. Because these changes will create the environment where healthier sperm can develop. It can. So it is in your hand to change. It's not in the doctor's hand. But people will come and say, "Oh, doctor, I have sperm issues. Give me drugs." These people are just ridiculous. So when people like me get to advise them, they say, "You didn't do anything for me. Why should I pay you $30 or $50? Don't pay. Go and collect drugs because you are looking for who will deceive you." So when you're asking yourself, "Why am I not pregnant?" These are the things you should consider. All right, send your request. Come up. Let's talk to you. If there's no question, it's almost time for me to go to bed so that I can also be producing quality sperm, right?